Yeah, you've not really missed much in the way of illustrations. So I've gone through what we're going to be achieving, and I've just started summarizing realist synthesis in brief. So realist synthesis is about testing these mechanisms, these responses to a resource, a stimulus, um, and the strength of realist synthesis includes being able to identify and test uh, unforeseen mechanisms, so handling the unexpected, perhaps in contrast to the sort of more planned path of a systematic review. And I've put there unforeseen. Now, from the realist world, it has to have some manifestation. You have to be able to see that something is happening, but um, uh, unseen also in the sense that we may not be able to see what's actually activating the mechanism. We just see the responses of it. So we're looking for cause, looking for the effect that we then impute a cause from. Um, and I use the word activate. The source of this summary actually prefers trigger, but recently I've started using activate because it has a much more encompassing meaning. It's less like the idea of just switching something on or off. It's activate in the perhaps in the biological or the chemical sense. So something gets something started of varying effect. A realist synthesis allows for both positive and negative outcomes of an intervention, and very much this is to do with things like the dosage of the mechanism. In some contexts, a mechanism may be more present; in others, it may be less present, and indeed the stimulus may be present in a higher dose or a lower dose. And overall, it's allied with principles of synthesis. So it's about synthesizing evidence to refine the theory that underpins the intervention. So many of you will have encountered an explanation for realist synthesis, so I won't stay much longer on that. But when we come to comparing realist synthesis with systematic review, we can see some big contrasts. That realist synthesis, as the previous description has indicated, is very much interpretive. Systematic reviews can cover the whole spectrum from aggregative to configurative or interpretive, but primarily they're located at the aggregative end, so we think perhaps of a conventional meta-analysis. Realist synthesis have a flexible and iterative process, whereas a staple of the systematic review is the protocol. We're allowed to go off-piste, if you like, in a realist synthesis, whereas in a systematic review, any deviations from the protocol have to be documented. We respond to the evidence as we look at it, and that can be a wide range of evidence. It can include policy documents, editorials. So you get that feeling of really harnessing a lot of body of evidence and opinion, uh, compared perhaps with a systematic review where you may pre-specify the types of studies or the types of evidence that you're going to be using. And the criticism, I suppose, of systematic reviews is that that certainly at the quantitative side, they often strip out context. They may have descriptive characteristics of the study setting, but it's usually very summary and lacks the sort of detail that might explain why something works in a particular context. Systematic reviews obviously grew up around interventions. They favor empirical evidence, although of course you can systematically review all types of material, for example, patient bulletin boards, but primarily it's about looking at research evidence. And a key part of the systematic review is assessing methodological quality, risks to rigor, perhaps we talk about, or risk of bias. Whereas in realist synthesis, we're looking more at the contribution of studies based on what are known as the 3 Rs: relevance, richness, and rigor. And I've put them in that particular order because we often go in search of relevance first. If we've got competing sources of similar relevance, then we maybe use richness to distinguish them. And rigor is used in sort of moderating our interpretation rather than as an inclusion criterion. And this is another way of comparing the two, and some of you may prefer this sort of tabulation for comparing. Notice that this particular summary claims that both realist review and systematic review are very rigorous. They certainly have a lot of analytical processes and checks in the system. Why the realist review is thought of as being less rigorous is often to do with issues about less detail of reporting rather than the quality of the actual processes. In terms of the usefulness of realist review, the systematic review is very much doing an averaging thing, demonstrating which intervention has the largest or smallest effect, whereas realist review focuses more on how to get the most effect for your intervention. So how can you make that intervention most useful? Now, what I did here, and it's a very busy slide, but I tried to find the richest critique of realist synthesis that I could find in an individual paper, and particularly looking for the impressions of someone who was doing this for one of their first times. I think in this particular case, the team was actually encountering the whole method for the first time. They certainly write the paper from that viewpoint. And so I just really wanted to flag up some of the challenges that you may have heard that may well be putting you off the idea of doing a realist synthesis. So this process of tracking and tracing the mechanisms can be very thought intensive, very intellectually demanding. Often it can be frustrating, particularly if you're doing this within a time scale, to have to go through the swamp of trying to understand the mechanisms before you get onto the clearer path of being able to make sense of things. This whole idea of mechanisms is complicated, and the example given by this particular authorial team was that a mechanism could activate one or more others. So the first mechanism then becomes the context for the second, and then the second could then become the outcome for the first. So it can be very complicated, and a lot of debate, particularly on the specialist Ramsey's discussion list, has featured whether it's possible to distinguish and how to distinguish a context from a mechanism. And we have to recognize that whereas interventions can be messy because they can have multiple components, that when you're looking at mechanisms within an intervention, it can get even messier because an intervention may activate multiple mechanisms in order to achieve its optimal effect. And indeed, mechanisms can be activated by quite different types of intervention. So the similarity is in the mechanism, but the interventions may look very different. So when you look at the whole issue of mechanisms, it's obviously quite problematic. When you put them together into what they call these CMO configurations or patterns, then it becomes even more challenging. And another more practical issue is how long you're going to spend on the different phases. We perhaps are used to systematic reviews having a defined searching phase, for example, when you go through the whole list of databases, and so the searching is finished when you reach the end of that pre-specified list. That's not the same with realist synthesis. And as a consequence, it's a little bit like having a blank check open for a while in terms of your time. The process is time intensive, but you may find that you expend all your resources before you're able to sort of reach the sweet spot that Pawson describes of where you're able to engage with evidence from other fields. And again, that's in contrast to a systematic review that often doesn't have that ambition of making links to other fields. And the sort of finishing note here, two statements, both for which Ray Pawson is attributed, that this whole process is not to be undertaken lightly, and it's not for novices. Nevertheless, this same team concluded that despite both the intellectual at the top of my slide and the practical challenges towards the end, they found realist synthesis was a very useful way of interrogating the literature, and it helped them to really get into the skin, if you like, of their particular topic, which was around team working, and provided the basis. It became a launch pad, if you like, for a subsequent empirical study. And that's increasingly how we're seeing realist synthesis used now to do some exploratory work that might be taken up in a realist evaluation by collecting primary data. And for this reason, it can be very attractive for PhD students to have underpinning their project, although, again, I wouldn't underestimate the challenges that exist in doing this at a PhD level. My own criticism of a realist synthesis was based more from my background as a systematic reviewer, that when it comes to making the connection between what you find in the literature and theory, if you have Ray Pawson on your research team, then it's likely that you can access all sorts of possible program theories through his experience. He's retired now, and anyone would be very lucky to have him on a research team. But so what do we do instead? Is it possible to systematically identify candidate theories? And that's something I've explored. And my criticism is really, is it like magicking an explanation out of a hat if we don't have an audit trail comparable to that we have for a systematic review? I'm put this slide up because it will underpin the examples I use, but it's not really to say as a bragging contest, if you like, but really just to emphasize the different types of context, the different types of funders, and the different types of topics that are open to inquiry by realist synthesis. So you can see here tremendous variety. As I've already mentioned, some privileging of the health service and delivery research context, but nevertheless we see other applications like health technology assessment, organizations like the Health Foundation, and associations like the Orthopaedic Research UK and Marie Curie. So if we're going to judge realist synthesis and its value, then the requirement for a synthesis is that the whole is greater than the sum of its parts. And when some of these parts are analogous to what you do in a systematic review, it becomes even more important to isolate that added value. So that's what we're going to do over the next few slides. So my 10 reasons to undertake a realist synthesis. The first one is an increasing recognition of the importance of context. So in the early days, context was virtually ignored in systematic reviews, and this was partly as a result of the fact that many of the early ones were around pharmaceuticals or interventions where in a more controlled environment where the context was actually being managed and was not really a variable. But as we've moved into social science and public health fields, we see that context is much more important, particularly as an explanation. And it has to be recognized that context in a realist synthesis frame is different from our traditional view of context, which is primarily described in terms of place and time. Context is about this combination of factors that may help to explain why a mechanism gets activated or not. And I've been interested in context in the context of systematic reviews, and the paper in the bottom corner there, taking account of context, shows how crude some of the approaches to looking at context are in systematic reviews. And again, we tend to turn it into labels rather than explore. On the other side, we have a very useful paper by Joanne Greenhalgh, and the references are at the end of my presentation, that actually tries to get a greater understanding of context, and in fact shows how researchers within the realist world have used two primary understandings of context, and so have really conflated or confused the more common one from systematic reviews with context in its specific realist meaning. So how can I illustrate the value of realist synthesis in terms of context? Well, this is a project that I'm currently involved in, funded by the Canadian Institute for Health Research. It's a 4-country project, and so in a systematic review sense, those would be contexts. But when you come to exploring these nursing staffing models, one of the things that we're starting to notice is that the use of healthcare assistants alongside nurses as a way of handling nursing staffing in some contexts is a substitution role, and in others it's a complementary role. And this is already starting to explain for us why there might be a difference between the success of healthcare assistants. Healthcare assistants, where they're there to complement or supplement the nurses, are actually obviously likely to increase the quality of care. Where they're stepping in to do things that were previously done by qualified nurses, that substitution model, that may well explain why they're not achieving the same effect as is achieved by when compared with nurses. So that was our first reason, the importance of context. A second reason, that realist synthesis is theory-driven. A realist synthesis is like a stick of rock in terms of theory. It runs all the way through, whereas in papers that we've written for the Cochrane collaboration, we've shown that theory otherwise is generally used at various stages or parts of a more conventional review. And realist synthesis isn't the only approach for engaging with theory. But it's certainly identified amongst this spectrum of model methods. The one that I most clearly have as an alternative, so that when I'm trying to decide whether to do a realist synthesis or not, is the idea of using logic models. And obviously you can use logic models alongside quantitative and qualitative data. You can use them in a mixed methods review. So a decision for many of us is, am I going to buy into the realist philosophy, if you like, the realist paradigm, go the whole way, if you like, or can I take a feature, that's the explanation of program theory, and use a logic model within a more traditional systematic review context? And so the work that I've done in using logic models more generally has really helped me to see that realist synthesis isn't the only alternative. It's very much a question of where do we get most added value from. And so if I'm trying to look at the value of theorizing, I turned to the case study where we were looking at supporting postnatal depression. And here we were looking at a number of ways of providing postnatal support, great variety amongst them. So it wouldn't have been very good to look at specifically interventions, but better to look at mechanisms. The variation included face-to-face versus telephone, individual interventions versus group interventions. Rather unusually, these reports did often make an explicit link to theory, which was a real help for us. But for the others, we would link them by recognizing how the rationale for these support interventions was underpinned by recognizable theory. And so just as an example of the value of this, obviously when you're in a group setting and you're being supported for postnatal depression with a view to improvement, social comparability, being in a group and looking round at other people, could be a positive. So she's getting better, I'm like her, therefore I'm likely to get better. Or it could be a negative. She's like me, she's not getting better, therefore I'm unlikely to benefit from this treatment. Or where it might be more of a comparison, she's getting better, but I'm nowhere as in such a good position as she is, so there's no way that I'm going to benefit from this intervention. So just looking at the mid-range theory, social comparability, really helped us to distinguish between those likely to benefit and those likely to find a group setting oppressive or unhelpful. And so here's an example of how we took individual interventions and mapped some of the underpinning theory as referenced in the source studies. And this is where we built our program theories. So program theory 1 around developing trust, more of that later, finding that women develop meaningful relationships with other women in the group and with healthcare providers, and the reason why that is likely to work can be explained by social cognitive theory, and it's particularly the group interaction that is helping to activate that particular mechanism. So two good reasons so far. The third one is that a realist synthesis privileges explaining things over predicting things. And obviously, the classic systematic review does focus on outcomes and on predicting outcomes, the implication that if you demonstrate that something happens consistently, then it's likely to happen in your own context in the same way. The example using here is a more resource limited realist synthesis that we undertook. Signposting services, you may know there's an encouragement that instead of people having direct access to a GP or to a practice nurse, that many of their needs might be met by a receptionist who has been trained to point them to support resources that are available in the community. And one of the challenges here is that if you look at evaluations of signposting services, you find that some studies find very favorably for them and others less so. And so in the context of reviews, it's not possible to predict whether a service will achieve positive or more measured, more balanced outcomes. And so what we found was that if you looked at why people were using these signposting services, that broadly speaking, they fell into two groups. Yes, there's the group that that can be handled by rapid referral from a receptionist, and this was sort of invoking the improved efficiency argument that health services promoted, but a smaller critical percentage, they needed more in-depth support, and so this interaction with a receptionist in this trained up role wouldn't be sufficient. And so that's where the sort of the quality of care narrative comes in, that actually you need to provide alternatives to signposting in the form of something a bit more in-depth, social prescribing. And another thing that we did on this particular review was that we chose one program theory from the perspective of each of the commissioner, the service provider, and the user, so that we could explore and explain different tensions. And that's quite different to Ray Pawson's original vision of it being the program developer who owns the program theory. We were identifying different explanations from the three different user groups. The fourth one, embrace complexity. Realist synthesis is particularly attractive in the context of complexity, and that was shown in that earlier quotation about options for exploring complexity. If you look at the scoping phase of a complex intervention, you'll see that many of the things we've already flagged up, things like the place of theory, are key to exploring complex interventions, and so realist synthesis ticks that particular box, and we'll come to the role of stakeholder input a little bit later, so spoiler alert there. So in terms of exploring complexity, the example I would draw on is when we did some research into appointment reminder systems. And the first thing that we were able to identify that would explain why these appointment reminder systems worked in different ways was that the clinics actually had different mental models or different assumptions according to how they were going to handle appointments. So you might be familiar with the first one from an aeroplane context, the overbooking model, so that you rely on people actually dropping out. So you book at over capacity, you deliberately overbook, and then with people dropping out, that returns to your capacity. And of course, the danger here is that people don't drop out. But so you actually want a percentage of people to ignore their appointment reminders so that you actually reach more your optimal capacity. Of course, the problem is that you then end up going far below the 100%, which is why this topic needs to be looked at. The alternative is the capacity booking model, where you book in at 100%. Again, you rely on dropouts, but that allows the GP to do some of those things that his otherwise busy schedule wouldn't allow him to do, and the same with a busy consultant. So you're relying on the dropouts as an opportunity to perform other tasks. And so that's part of the complexity of that intervention. Another one is that people have different motivations for attendance. So we arrange the typical attendance rates for appointments in order from highest to lowest. And it was very interesting to see that studies that looked at appointments for children, or where people were following up a diagnostic test that had been taken, so they were hearing the result of a test, their attendance was likely to be high. Whereas if you were getting a more generalized appointment reminder, for example, for blood donation, that's quite clearly aimed at your community, then those percentage turn-ups were low. And so this was another explanation for some of the complexity of the results of appointment reminder systems. On to fifth reason, we mentioned before that Ray Pawson drew attention to the fact that realist synthesis is good at making synthesis across disciplines, engaging with theoretical frameworks from other areas. We did a research capacity development review where we looked at ways that organizations in health and social care could build up research capacity, and just want to highlight from the center here the multidisciplinary nature of some of these theories of what is going on here. So everything from the Lewin model of change to theories of co-production, experiential learning, social capital. So very much an opportunity to make connections from what we were observing in a health and social care context to these other disciplines. On to 6, learning from failures. It's very hard to detect failures from systematic reviews, but realist synthesis is very interested in circumstances when interventions don't work as well as those that do. And this is one of the early ones that I've been involved in. It was a funded project from the NIHR Public Health Program on community engagement. And this was an example where a project in Glasgow had drawn on a predecessor project from the United States that had used gay community opinion leaders to try and make people receptive among the gay community to be receptive to health promotion messages. And this had proved a success in the US, but a failure in Glasgow. And when we looked at this in more detail, we saw that whereas the Glasgow Gay Men project focused on the shared phenomenon of being gay, they had overlooked the important factor that these people that have been used in the United States had actually been chosen because of opinion leaders, not just because of their homogeneity with the population itself. And another factor that was important was that the intervention was actually delivered in nightclubs, not in the community. And we found very interesting anthropological evidence about how nightclubs amongst the gay community have, if you like, their own tribes, and those tribes can be quite distinct. And so someone from one tribe was unlikely to exert a positive influence on someone from another of those tribes. We're well over halfway here, so stakeholder involvement is very often mooted as a real selling point for realist synthesis approaches. This isn't something that is completely unique to realist synthesis. Perhaps this distinction was more clear a few years ago. Certainly when I started doing systematic reviews, they were reassuringly confined to doing them in your office. You didn't have to go out and meet real people, so there were no disruptions to your timetable and you delivered them on time. Obviously that's the old culture, and we welcome the fact now that stakeholders are involved in systematic reviews to make them more meaningful and more relevant. But certainly for a while, realist reviews took this input from stakeholders to a much greater extent than we saw typically in systematic reviews. Interestingly, we've been sort of making a compare and contrast here by using the active framework from systematic reviews in general when looking at the role of advisory groups in realist reviews. And we've got a manuscript that draws on the systematic review tradition to organize our findings. So the example of the positives of stakeholder involvement, again, a fresh topic, one that I'm involved with at the moment. This is working in the field of adults with learning disability. In the UK, individual service funds are available for those adults to negotiate with assigned providers to be able to spend on what they actually need to support themselves. And this has been particularly interesting as an example of stakeholder engagement because of the specific needs of the adults with a learning disability when participating in the topic and in the project. Just wanted to share with you, and I take absolutely no credit for this, but this is the wider team, what are called easy read meeting notes. So here you have the description of the realist review, specifically targeted to include our stakeholders, so that it privileges this way of explaining to them what we were doing within the realist review, and all of us, all members of the advisory group, receive the notes in this format. So it's actually refreshing for us to read these meeting notes, as well as benefiting adults with learning disabilities. Another claim for realist synthesis is that it's iterative and flexible. We've talked about the fact that although you may have to produce a protocol, within that protocol you have a lot of flexibility, you adapt to new findings and emerging theories. This sort of illustrates it in a study we did of African food systems. We started by looking at review evidence. we then went to specific evidence relating to the two target countries, Ghana and Kenya, and where that evidence was incomplete, we then extended it further to other sub-Saharan countries. And so you can see that had we simply focused just on the reviews or just on the Ghana and Kenya without going back, then we would have had an incomplete picture. But by having multiple iterations, we were able to build up the whole explanations. And this becomes challenging, as we alluded to in the introduction, when it comes to how do you present this. And so here are a couple of examples with references of the complexity and challenge of, for example, doing searching within the literature. And I'd refer you to both these papers. The diagram in the top one that I led on is down to Judy Wright, who very effectively captured the multiple interactions, the multiple screening and data extraction phases that you engage with in a typical Realist project. Transferability of findings. This, because you're working in mechanisms and looking at the importance of context, it is set up for transferable knowledge with a systematic review. That tends to be a supplementary add-on process where you sort of say implications for practice and you take into account any differences in context. So the example I wanted to share here is across two case studies. So we did some work which looked at access to social care for Black and minority ethnic groups. And currently I'm working with a team that is looking at Pakistani end-of-life care. And what's been interesting for me is to see that issues about ethnic minorities being looked after by social care staff of shared ethnic origin surface with similar concerns about community workers or researchers researching the end-of-life needs within their own community. So you can see here they're not exactly the same, but certainly considerations that these people who share an ethnic origin have that head start of having an understanding of the culture, customs and community in both cases. But then there are concerns about confidentiality and the fact that you're sharing privileged information with someone who might the following day be within your community and could potentially pose a danger to the insights that you've shared with them. And on to number 10, appropriately concluding here, the value of realist synthesis in policy and practice. I've picked policy for this particular instance. I've gone back to those African food systems. We worked with separate teams in Ghana and Kenya. We produced overall program theories, and then we looked in more detail at the country-specific cases. And we worked closely, co-produced this with local researchers who were able to provide the reality check. And what we found was the key role of what are called food composition tables. And if food composition tables or data was available, that actually helped in a lot of the other food management processes. But if they weren't available, then this contributed to a lack of success in some of these areas. And this has led to support for pressure to get Ghana to resume producing food composition tables, along with other sources, but the reviewers certainly contributed. So in summary then, the summary slide here, 10 good reasons why we might want to consider realist synthesis. Just going to briefly conclude now by some of the challenges that we face. So first of all, can a realist synthesis be done in a systematic way? Some of the tools that we've used to help us do this are the Pearson time and task template, which very much codifies the different stages that one would go through. They are iterative, but in terms of processes, this is a very good map for activity. And located within that is our own work, looking at the 6 stages of a realist search. So certainly we can have more of a system within these overarching processes. In this case, the blue slide maps into number 2 in the time and task template. Where does Realist Review fit within a toolbox of review approaches? Well, it's not a sort of overwhelming first choice. It has its own place within mixed methods reviews families, and so often the decision for me is whether to do a mixed method review, which will involve both quantitative and qualitative reviews, or a realist review, and the advice we give is predicated on a number of those considerations, particularly the foregrounding of theory. So if theory is being foregrounded, that will often be a clincher. And we can see where realist synthesis might fall just within the realm of qualitative synthesis. It does more than that because it uses quantitative data. But here you can see if a topic's already well theorized, then there's less justification. There's a requirement that the data is rich enough for theory generation. But above all, are we trying to explain how things work? And that's what really points us towards the realist synthesis. How things work, not whether things work. And in terms of can we be systematic in our searching, we've contributed a number of papers both on the phenomenon of the realist search. I've already referenced other authors who work in this area, and also particularly on how you can systematically search for theory. So why am I not yet a convert? Well, I'm going to leave this slide up. The terminology is a barrier. I find that a CMO configuration still turns me off, and I prefer thinking of them more in the lay language of statements of if, then, leading to. The methods are still poorly described. It's very much a direction of travel rather than a detailed map. The findings at the top level may end up as motherhood and apple pie, or those of you who are familiar with Faulty Towers, the specialist subject of the bleeding obvious. So the number of realist reviews that I've seen that has identified trust as a mechanism is mind-blowing. Realist syntheses often neglect the full power by only exploring the qualitative synthesis, and therefore if you're comparing them with qualitative evidence synthesis, does realist synthesis really have an edge? They could potentially offer an inferior way of integrating quantitative and qualitative data because they do it in a less systematic way. There's no such thing as a rapid realist synthesis. If you've got limited resources, then you limit the number of program theories that you explore once you've generated them. And finally, I still think that there's a sense of magicking out of a hat. So my program theory is if you assemble a multidisciplinary team and stakeholders with realist expertise and have procedures for developing and prioritizing program theories, and realist methods are offering an advantage over other review alternatives, then you can undertake a realist synthesis, leading to you delivering an insightful interpretation within time and resource limitations. Thank you.